हेलो फ्रेंड्स, वेलकम ऑल ऑफ यू। आज का हमारा टॉपिक है नर्सिंग केयर प्लान ऑन जेनेटिक काउंसलिंग। दिस इज़ वेरी वेरी इंपॉर्टेंट नर्सिंग केयर प्लान जो हमने आपके लिए तैयार किया है जेनेटिक काउंसलिंग का। ये केयर प्लान आपको बहुत कम देखने को मिलेगा और आप इसको इजीली तैयार कर सको, इजीली फाइल वर्क के लिए या एग्जामिनेशन के लिए हमने आपको ये केयर प्लान तैयार किया है। तो आप वीडियो को कंप्लीट देखिएगा एंड लर्न with this video the nursing care plan on genetic counseling। तो आइए देखते हैं नर्सिंग केयर प्लान या एनसीपी ऑन जेनेटिक काउंसलिंग। सबसे पहले देखते हैं जेनेटिक काउंसलिंग। व्हाट इज जेनेटिक काउंसलिंग? हियर genetic counseling is a communication process that deal with the human problems associated with the occurrence or risk of genetic disorder in a family। जेनेटिक काउंसलिंग एक कम्युनिकेशन प्रोसेस है जिसके अंदर जो व्यक्ति है अपना जो भी प्रॉब्लम है रिलेटेड टू जेनेटिक डिसऑर्डर इन फैमिली उसके कंसर्न में कम्युनिकेट करता है, डील करता है विद जेनेटिक काउंसलर। तो ये देखते हैं हमारे यहाँ प्रायोरिटीज क्या होगा, नर्सिंग प्रायोरिटीज इन दिस केयर प्लान। असिस्ट क्लाइंट कपल फैमिली टू रिकॉग्नाइज एंड अंडरस्टैंड स्पेसिफिक सिचुएशंस। मीन्स जो भी हम जेनेटिक काउंसलिंग का केयर प्लान यहाँ पर तैयार करेंगे इसका हमारा प्रायोरिटीज होगा नर्सिंग प्रायोरिटीज़ की जो भी कपल है, फैमिली है, वो स्पेसिफिक सिचुएशन को अंडरस्टैंड करे, रिकॉग्नाइज करे। नेक्स्ट सेकंड, फैसिलिटेट थेरेपेटिक यूज ऑफ इंफॉर्मेशनल रिसोर्सेज। नेक्स्ट थर्ड, प्रोवाइड ऑनगोइंग इमोशनल सपोर्ट। नेक्स्ट, डिस्चार्ज गोल ऑफ दिस केयर प्लान एयर cope effectively with situation, complete counseling. Next, complete counseling process. Next, understand information specific to situation. These are the discharge goal of this nursing care plan. Next देखते हैं nursing care plan first year। Here first step of nursing process, nursing assessment। First manifest here manifestation of anxiety. Next, history of genetic disorder। Next, expressed concern of and fear. Next, family and social support available। Next, defining characteristics like here increased tension, apprehension, feeling of inadequacy, insomnia. On the basis of these nursing assessment, we write a nursing care plan, nursing diagnosis here. For this care plan, first nursing diagnosis here, anxiety related to presence of specific factor, example history of genetic problem, exposure to teratogens। दिस इज आवर नर्सिंग डायग्नोसिस। यहाँ पर हमारा एक्सपेक्टेड आउटकम से गोल होगा क्लाइंट विल appear relaxed and report that anxiety is reduced। Here our goal is client will appear relaxed and report that anxiety is reduced। इसके लिए हमारा इंटरवेंशन होगा इंटरवेंशन फॉर दिस डायग्नोसिस एंड स्पेसिफिक रेशनल्स। मीन्स व्हाट द रीजंस फॉर दिस इंटरवेंशन। Here intervention and rationals। Intervention number first, assess nature, source and manifestation of anxiety। Rational here, identify a specific area of concern and determine directions for possible intervention। Next, intervention, provide information about the specific genetic disorder, risk involved with reproduction and available prenatal diagnostic measures। Here rational is, may relieve anxiety associated with the unknown and assist family to cope। Next, intervention here, promote ongoing sharing of concern and feeling। Rationalists provide opportunity for discussion of the test result। Next, intervention देखते हैं, review procedure and what to expect in term of discomfort। Rationalists Information can reduce anxiety. Next, visit couple after procedure here. Follow-up visit by the nurse may relieve anxiety. Next, provide opportunity for client wing resolution of situations. A rationalist help to confirm diagnosis and reduce anxiety. And next, refer to further counseling as indicated. Example, psychiatric referrals. A rationalist for additional professional assistant. Means after these interventions, we write a evaluation for this nursing diagnosis on the basis of expected outcome. Here our evaluation is client appear relaxed and anxiety reduced. तो यहाँ पर हमारा फर्स्ट नर्सिंग केयर प्लान कंप्लीट हो गया है. नेक्स्ट देखते हैं नर्सिंग केयर प्लान सेकंड डायग्नोसिस. Nursing assessment for second diagnosis, family history of genetic disorder, available support system, defining characteristics like verbalization of the problem, statement of misconception, request for information. These are the defining characteristics during nursing assessment. On the basis of nursing assessment, we here write the nursing diagnosis. Number second, knowledge deficit regarding purpose and process of genetic counseling related to lack of awareness of the purpose of genetic counseling. This is our second nursing diagnosis of genetic counseling. Their expected outcome or goals for this diagnosis. Client will describe the disorder and identify available options. This is our goal. Next देखते हैं intervention. Here intervention and specific rationale. Here first intervention discuss the purpose of genetic counseling. Here rationale is serve to educate parents. Next, carry out ongoing family assessment for available support system. Here rationale is negative coping may interfere with the cognitive function and hinder educational process. Next, arrange for follow-up visit to counseling service. Here rationale is provide opportunity to reinforce information when family is ready to hear it. Next intervention is uh, provide information about here provide information about individually appropriate diagnostic procedure screening. Here rationale is prenatal diagnosis permit preparation for or offer an alternative to having children with genetic disorder. Next, encourage participation with support groups concerned with genetic disorder. Here, rationale is help the client and provide role model and information about genetic disorder. Next, intervention here. This is last intervention. Obtain referral with especially clinics and agencies that deal with the specific genetic disorder. Here, rationalism may be needed to answer a question and concern. These are the interventions for this diagnosis. Next, after providing these interventions, we write evaluation for this process. Here, evaluation is client describes the disorder and identifies available options. तो इस तरह से ये हमारा सेकंड नर्सिंग डायग्नोसिस कंप्लीट हुआ. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर थर्ड फॉर जेनेटिक काउंसलिंग. हियर नर्सिंग असेसमेंट for nursing diagnosis number third, relationship of couples to one another, strength of the family bonds, perception of the disorder. Here nursing diagnosis, risk for altered family process related to situational crisis. Here goal or expected outcome is client will participate in decision making process. And here intervention and rationale for this diagnosis, we write here intervention and rationale. First intervention, determine couples' relationship to one another, strength of the family bond and support system. A rationalist establishes baseline data. Next, assess couple perception of disorder. A rationalist the way family member respond depend on their perception. Next, provide opportunity to verbalize concern. A rationalist to resolve problem. Next, review all options available to the client couple, such as adoption, postponing. Here, rationalists provide opportunity for decision making. Next, assisting in problem solving and exploring alternative solutions. Here, rationalist helps arrives at decision. Next, here intervention refer to social worker, counselor, or supporter. Support groups here in rationalism may be necessary to help solve the problem and prevent family disintegration. Means after providing these interventions, we write at last step of nursing process here evaluation. Client discuss available options, participate in decision making process. Here our goal is achieved by providing different interventions. तो ये था हमारा नर्सिंग डायग्नोसिस नंबर थर्ड. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर फोर्थ. Here nursing assessment, specific test planned, performed, and manifestation of complications. On the basis of this nursing assessment, we write here the nursing diagnosis, risk for injury related to complication of testing procedure, and here expected outcome or goal is client or couple will identify risk and way of minimizing them and be free of preventable complications. This is our goal or expected outcomes for this nursing diagnosis, that is risk for injury related to complications of testing procedure. For this diagnosis, we write here the interventions and here rational intervention. First, identify the necessity of the specific test and association risk. Here, rationalize information help client to make informed decision. Next, intervention review the indication for genetic counseling. Here, rationalize purpose for genetic counseling. Next, review here sign and symptom of complications such as premature labor, infection, abruptio placenta. Rationalize client need to recognize there as being important to report the health care provider. Next, assist with obtaining blood or tissue, placenta or chromosomal biopsy. Here, rational is a nature of disorder determined by the different testing. Next, assist procedure and use external fetal monitor for 20 to 30 minutes after active procedure. A rationalist careful monitoring may reduce untoward effects. Next, intervention position mother on left side. A rationalist increase placental circulation. Next or last intervention here administer medication as antibiotic and RH immunoglobulin. A rationalist give prophylactically. These are the interventions for this nursing diagnosis. After providing these interventions, we write here the evaluation for this nursing diagnosis. Here, evaluation is client identifies risk way of minimizing them and remain free of preventable complications. This is our evaluation for this diagnosis. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर फिफ्थ. ये nursing assessment, preparation of self, expression of feeling, manifestation of grief, manifestation of denial, self negative, feeling of guilt, powerlessness, and anger. These are the defining characteristics after assessment. Here, nursing diagnosis for this low self esteem related to perceived failure of a life event. Next, expected outcome client will lessen sense here. Client with lessen sense of guilt and restore feelings uh, or self-worth. Next, here intervention and rationale for this diagnosis. Determine self-perception of client, couple, identify and reinforce individual mutual strength. Next, rationale for this intervention, provide opportunity for nurse to learn about clients' expectations and perception of genetic disorder. Next, intervention here, provide or reinforce information regarding risk, estimate, discuss with client and couple together and separately. Here, rational is help reduce guilt feelings, promote recognition by couple that some control over the outcome is possible. Next, intervention, arrange for follow-up visit. Irrational is provide opportunity to reinforce information. Next, intervention here, assess for recurring unresolved conflict. Here, rational is professional help may be required to resolve low self-esteem. Next, here, intervention, refer for counseling as needed. Irrational is to resolve grief process and promote self-esteem. After providing these interventions, we'll write last step of nursing care plan here, the evaluation. Lessen sense of guilt and restore feeling of self worth. Here our goal is achieved by different interventions. तो ये था नर्सिंग डायग्नोसिस नंबर 5 ऑफ नर्सिंग केयर प्लान ऑन जेनेटिक काउंसलिंग. तो एक बार आप फिर सभी नर्सिंग डायग्नोसिस और केयर प्लान को यहाँ देख सकते हो. ये था हमारा फर्स्ट नर्सिंग डायग्नोसिस, एंजाइटी रिलेटेड टू प्रेजेंस ऑफ स्पेसिफिक रिस्क फैक्टर, एग्जाम्पल हिस्ट्री ऑफ जेनेटिक प्रॉब्लम, एक्सपोजर टू टेराटोजेंस. तो आप यहाँ पिक्चर से अपना नोट्स ले सकते हो. नेक्स्ट, सेकंड, नॉलेज डेफिसिट रिगार्डिंग पर्पस एंड प्रोसेस ऑफ जेनेटिक काउंसलिंग रिलेटेड टू लेक ऑफ अवेयरनेस ऑफ द पर्पस ऑफ जेनेटिक काउंसलिंग. ये सेकंड डायग्नोसिस के यहाँ नोट्स ले सकते हो. नेक्स्ट, थर्ड देखते हैं नर्सिंग डायग्नोसिस थर्ड, रिस्क फॉर अल्टर्ड फैमिली प्रोसेस रिलेटेड टू सिचुएशनल क्राइसिस. तो यहाँ से आप नोट्स ले सकते हो. नेक्स्ट, नंबर 4 डायग्नोसिस, रिस्क फॉर इंजरी रिलेटेड टू कॉम्प्लिकेशन ऑफ टेस्टिंग प्रोसीजर. तो ये फोर्थ डायग्नोसिस है और यहाँ आप पिक्चर से आसानी से नोट्स अपने ले सकते हो. नेक्स्ट, नंबर 5, लो सेल्फ एस्टीम रिलेटेड टू परसिव्ड फेलियर ऑफ ए लाइफ इवेंट. दिस इज लास्ट नर्सिंग डायग्नोसिस और यहाँ से आप अपने नोट्स ले सकते हो. तो फ्रेंड्स, ये था हमारा आज का नर्सिंग केयर प्लान ऑन जेनेटिक काउंसलिंग. आपको वीडियो कैसा लगा इसके लिए अपनी लाइक ज़रूर भेजिएगा एंड write in comment box and share this nursing care plan video with our friends and subscribe my YouTube channel Anand's Nursing File, a preparation for nursing competition examination, and press bell icon all. Thank you.